All right, Robert, we're going to talk about your medication.
Okay.
Because you take a lot of medication, don't you?
Yes.
Yes, and it's for a lot of different things. So the first thing you take medication for is for your epilepsy,
Yes.
to help control the seizures. And we have this is all medication that Robert takes every day. It's a lot of meds. And he has 7 times a day that he takes medications, and I put them every Sunday in these containers. So after we're done here, I'll be filling up the containers again. But what he takes, let's see, let's start with your Depakote. You take 500 milligrams of Depakote twice a day. This little pink pill. He used to take it 3 times a day, but his ammonia levels are really high, which makes him very drowsy. So the doctor actually reduced the midday one, the one he takes at 2 o'clock in the afternoon, to 250 milligrams. And so what we've got is this blue pill, and that is what he takes midday, around 2 o'clock. And those are for seizure control. Now, this does increase his ammonia levels in his liver, and so he takes these levocarnitin tablets to help reduce that. Hi, Taz. 330 milligrams in each tablet, and he needs 3 of them 3 times a day. So that is quite a bit of levocarnitin to help reduce the ammonia levels. They're still really high, but it helps a lot to be on that medication. So the other thing for seizure control, we have Zonogram, and he takes 500 milligrams twice a day. Did I say 500? He takes 400 milligrams twice a day. 4 pills, 100 milligrams each, twice a day. Once when he first wakes up, and then once at bedtime. Those are your 4 pills that you take twice a day, right?
Yes.
And that helps with seizures. He used to be on 300 milligrams maybe a year ago, and that was twice a day, and the doctor upped it to 400 morning and night just to help control the seizures. That didn't help, actually. So last February, the neurologist tried triliptol, also oxcarbazepine is another name for it. I like to call it triliptol because I can pronounce that. So he's on a very low dose of that because he had an adverse effect. It was affecting your mobility. You couldn't walk very well with it, and it was affecting his mood. So he's on 150 milligrams twice a day for this, and we just can't take any more. This is as much as he will tolerate, and it's this little orange pill. Yep. And that helps with your seizures. And that has made a huge difference in his seizures. He used to have seizures every day, multiple times a day, and would have clusters as well. And now with this, he can go a few days without seizures, sometimes up to 5 days without a seizure, which is remarkable. So this stuff really works for him. And everybody...
That's good.
That is good, yes. And everybody's different, so it depends on the combination of meds, and what works for one person may not work for another, or may have a really dramatic effect on another person. So you have to just work with the neurologist to figure out the best thing. So what's the clonazepam? Robert also takes this 3 times a day. It's a 2 milligram tablet. He used to have 2 milligrams twice a day and and then 4 milligrams at dinner, but it was making him very drowsy. This can make you very, very drowsy. And it's not typically for seizure control. It's more of like a mood relaxer, and I don't know for sure, but that is my understanding. But it has been used for seizure control, and he has been on this for a very long time. He's been on Depakote for years and years. Zonogram, the same. So triliptol is really the only new medication that he's on right now. These others he's been on for years. And it's given him the best seizure control after numerous starts and stops with different medications, and he was even in drug trials trying different medications.
That's good.
Yeah, you always volunteer for different things, don't you?
Yes, I do.
Yes, you do. Okay, so Robert gets very congested, and he winds up in the hospital with pneumonia very quickly. And usually sepsis is right along with it. So it's very critical to keep him as healthy as possible. So in order to minimize the congestion, he takes Mucinex twice a day. He takes Allegra once a day. Usually we get Allegra D, but the pharmacy runs out sometimes, so we have to get regular Allegra. And then he takes Flonase, which this is just 2 shots, 2 sprays in each nostril, and we shoot it up there and he sniffs, and that's supposed to loosen things up. So those are all for congestion. He also has hypothyroidism, and he takes medication for that. It's levothyroxine, and he takes 150 microgram tablet a day, and that is in the morning before mealtimes. I don't know how he got that, but that's just what he has. So what else do you have? What is this? This is your Pepsid. He also has GERD, and although we do blame the Rocky Road ice cream.
That worker, that's confused.
I know you do, I know. So he's taking famotidine, and thankfully I'm not a pharmacist because I don't have to say these every day. But it is just a prescription strength Pepsid, and he takes that once a day. The newest medication is his Cinemet. And I do not usually keep it in a baggie, but because he goes to a day program, they need to have the original pharmacy bottles, and I didn't have an extra ones because, well, mainly because this is a new medication. So he takes this 1 tablet 3 times a day, and this is from his new neurologist, his movement disorder specialist. And they found out when he was in the hospital this most recent time that he has Parkinsonism, which is a movement disorder, and all it is the symptoms of it, of Parkinson's, but not the actual disorder. That's how they explained it to me. So his muscles are very rigid, and this helps loosen up his muscles and is supposed to help with mobility. And he also has a swallow disorder, which is related to that. So all of this, it actually has really helped. It was fortunate that he had a movement disorder specialist on rotation when he was in the hospital this last time. She recognized the problem right off. So she put him on this medication, prescribed physical therapy, and now you're moving around better than ever, right?
Yes.
Yeah, that's terrific. Doing great.
Thank God for that.
Yes. And so the last thing, because the seizure medications do affect bone health, he's on this calcium, which he takes once a day to help with bone strength. And that's it. Do you have anything to say?
Well, I'd like to keep going for all they have me to do.
Yeah, okay. All right, you want to say goodbye? Oops, sorry.
I'd say goodbye to them. God bless them too.
All right. Well, thank you very much, Robert.
Have a nice day. God bless you.